What causes autoimmune blistering diseases? These blistering disorders happen when immune system attacks healthy skin. The immune molecules called antibodies target proteins which help link neighboring skin cells to one another. When these connections are broken, the skin becomes fragile and fluid collects between the layers of the cells, forming blisters. What is pemphigus? Pemphigus is an autoimmune blistering disorder. This causes blistering of the skin and of the insides of the mouth, throat, nose, and eyes. People with this disorder develop antibodies against desmogleins. Desmogleins are substances which make two skin cells stick to each other. When these bonds get disrupted, the skin becomes fragile and fluid collects between its layers, forming blisters. Is admission necessary for autoimmune blistering diseases? In some cases, to take care of the wounds or to give the treatment, a patient may be needed to be admitted. Are autoimmune blistering diseases life-threatening? For most people, the disease can be controlled with treatment. Pemphigus is a potentially life-threatening autoimmune blistering disease. How to take care of the wounds? The wounds need to be taken care of by using normal saline and non-adherent dressing materials. Are autoimmune diseases completely curable? There is no cure for autoimmune diseases, but the symptoms can be managed, especially with the advent of new medications like biologics. Can any medications cause autoimmune blistering diseases? Some antibiotics and antihypertensives are known to trigger blistering disorders. These can happen after months of taking the medication. Are autoimmune blistering diseases life-threatening? For most people, autoimmune blistering diseases can be controlled with treatment. Amongst them, pemphigus vulgaris is a life-threatening autoimmune blistering condition. What is pemphigoid? Bullous pemphigoid is an autoimmune blistering disease that can affect any age, but mostly affects the elderly. It presents as itchy lesions on the body with blisters on the legs, arm, and abdomen. Do autoimmune blistering disorders require hospitalization? In some cases, autoimmune blistering disorders may require hospitalization, like for wound care and management of pemphigus vulgaris. How is an autoimmune blistering disease diagnosed? An autoimmune blistering disease is diagnosed by the clinical features, biopsy, and immunofluorescence studies. Are autoimmune blistering diseases contagious? No, autoimmune blistering diseases are not contagious. Though some of these conditions may run into families because of a genetic predisposition, they definitely do not spread by touch. What is epidermolysis bullosa? Epidermolysis bullosa is a rare condition that causes fragile, blistering skin. The blisters may appear in response to minor injury, even from heat, rubbing, or scratching. In severe cases, the blisters may occur inside the body, such as in the lining of the mouth or stomach.